Written by experts and authorities in the field and professionally narrated for easy listening, this crash course is a valuable tool both during school and when preparing for the USMLE, or if you're simply interested in the subject. The audio is focused and high yield, covering the most important topics you might expect to learn in a typical medical school surgery course. Included are both capsule and detailed explanations of critical issues and topics you must know to master the course. The material is accurate, up-to-date, and broken down into bite-sized sections. There is a Q&A and a key takeaway section following each topic to review questions commonly tested and drive home key points. Also included is a comprehensive test containing the top 100 most commonly tested questions in surgery with the correct answers. To get the most out of this course, we recommend that you listen to the entire audio once while taking notes, then go back and listen to areas you had difficulties with. AudioLearn's medical school crash courses support your studies, help with USMLE preparation, and provide a comprehensive audio review of the topic matter for anyone interested in what medical students are taught in a typical medical school course. In this course, we'll cover the following topics: basic surgical principles, perioperative management, trauma and critical care surgery, transplantation and immunology, surgical oncology, head and neck surgery, breast surgery, endocrine surgery, esophagus surgery, abdomen surgery, chest surgery, and vascular surgery. Now, let's get started. Preoperative testing. There are several tests necessary in cases of an upcoming surgery, particularly if the surgery is to be a major surgery. The tests are present to help identify if the patient is healthy enough to undergo major surgery. If the surgery is minor, only a few tests are done during the preoperative period. The various tests necessary before a major surgery include the following. A CBC, blood sugar level, and bleeding studies are done to make sure the patient's blood count is normal, that they don't have anemia or diabetes, and that their kidney and liver are functioning normally. If blood transfusions are anticipated, the blood type may also be checked in case the patient requires blood during the procedure. A urinalysis is done to check for an occult urinary tract infection and to make sure the kidneys are producing urine that is normal in character. A chest X-ray is done to evaluate the patient's lungs and is done for major surgeries and in patients older than 50 years of age. An electrocardiogram is done on older patients who may have occult evidence for heart disease that only shows up on an electrocardiogram. Other tests directly evaluate the reason for the surgery and include a CT scan, MRI scan, PET scan, and other X-rays that evaluate a tumor if this is the reason for the surgery. Oblique incisions. There are several oblique incisions in the abdomen. The most common is the McBurney's incision, which splits the muscles from the iliac spine up to the umbilicus. Open appendectomies are commonly done with this incision, and muscles can be spared if retractors are used to pull them away from the surgical field for better exposure. If it needs to be extended laterally, the fibers of the external oblique muscle are exposed and usually pulled out of the way. If it needs to be extended medially, cutting into the anterior rectus sheath and rectus muscle may need to be done. And there are a lot of epigastric vessels that need to be found and cut to control hemostasis. When the surgery is done, the muscle fascia needs to be reconnected, but the muscles that are cut are left cut, but approximated so that they have a chance of growing back and healing. Absorbable sutures are used because non-absorbable sutures can irritate the tissues and can increase the infection risk. This type of incision heals well and has a good cosmetic outcome. A subcostal, bilateral subcostal, or chevron incisions are utilized when the surgeon wants access to both the upper abdomen and the flank. It really is best for open cholecystectomies, surgery to the bile ducts, resection of pieces of liver, liver transplants, surgery to the duodenum, removal of the adrenal glands, and open removal of the kidneys.